Hi, everyone. Today we are going to talk about the importance of back safety. This PowerPoint is provided by the National Safety Compliance. Back injuries are considered by OSHA to be the #1 workplace safety problem. Back injuries are usually very painful and expensive to diagnose and treat. Once a person suffers a back injury, they will often have back problems for months, years, and even their lifetime. The purpose of this training is to provide you with knowledge about the back, some causes of back injuries, proper ways to lift and move items, and steps to take to strengthen and protect the back. The back is a complex and intricate system made up of many components. The primary components are the spine, spinal cord, and muscles. Most back problems are related to the spine. The spine is part of the back which supports the trunk and the head. It protects the spinal cord as well as giving flexibility to the body. The spine is made up of many small bones called vertebrae and has a natural S shape. These vertebrae are connected together by spinal discs, which act as shock absorbers to cushion and separate the vertebrae. The spinal cord is the central nervous system for the entire body and is composed of millions of nerves. There are approximately 400 muscles which help stabilize the spine and help with proper posture. More than 1,000 tendons connect these muscles to the spine. There are several injuries which can occur to the back. Some common back injuries include strains, sprains, and herniated discs. Improper lifting and carrying techniques, poor posture, lack of exercise, and poor diet all contribute to back injuries and problems. Injuries are often the result of years of neglect and misuse. Once the back has become weak, any sudden movement or improper lifting technique can cause injury. Back pain can last a few days or even several years. The back generally deteriorates with age, and your overall physical condition plays an important role in the aging process. Over time, the back muscles tend to lose strength, and the spinal discs can tear, rip, or become herniated. Lack of exercise, a poor diet, and excess weight can all expedite this deterioration. An unhealthy diet can lead to health problems and excessive weight. Extra weight means more strain on the back, and lack of exercise leads to a weak back. This is a recipe for back pain. Good posture is important for a healthy back. The spine functions best when its S shape is maintained. Sitting, standing, or lying down incorrectly for long periods of time can affect the back negatively and cause muscle fatigue and back pain. Muscle tension can also be brought about by stress and anxiety. Tight muscles can cause muscle spasms and back pain. Whether you slip, trip, fall, get struck by machinery or equipment, or are involved in an auto accident, being in an accident can cause serious back pain. Repetitive motions, awkward work positions, and static work positions can cause musculoskeletal disorders, which refer to injury or damage of the skeletal muscle, tendons, bones, ligaments, joints, nerves, blood vessels, or related soft tissue, including strain, sprain, and inflammation. To minimize the possibility of back injury, you need to practice safe and correct lifting techniques. Here are some guidelines for lifting and carrying safely. Plan ahead. Before lifting an object, know where it will be placed. The path should be clear of any obstacles. This will help prevent any awkward movements while carrying the load. Be sure to prop the doors open or have someone there to keep them open if necessary. Take the safest route and avoid slippery and uneven areas. If lifting with another person, agree on a plan beforehand. Check the weight. Before you lift or carry an object, check its weight. Pick up a corner or push the object lightly. If the object is too heavy, get help or use a mechanical device. Get help with a bulky or awkward object and with objects which block your line of sight. Never lift anything unless you're sure you can do it safely. When lifting a load, stand close to the object with your feet shoulders width apart. This will provide a solid base for lifting. If your feet are too close together, good balance is difficult to achieve. Too far apart, and movement will be reduced. Keep the back straight and bend at the knees. Never use your back to lift. Focus on keeping the spine straight to shift most of the weight off the back and onto the legs. Keep eyes up and look straight ahead. This will help keep the back straight. Tighten abdominal muscles. Doing so will help the back stay in good lifting position and help keep from straining the back. Lift the object close to the body. This keeps the body stabilized when lifting. When the load is too far from the body, additional stress is placed on the back. Lift with your legs. The leg muscles are much stronger than your back. Lift straight up, moving slowly. When turning, move your feet and never twist or turn the back when lifting or carrying a load. When carrying a load, keep the back straight or slightly arched. Walk slowly to keep the load close to your body. Use your feet to change directions, avoid twisting the back, and avoid leaning over and keep the object close to your body and avoid lifting over your head. When setting the load down, stand as close as possible to where you want to set the object. Squat down to lower the object using your legs. Don't bend at the waist. Keep your head up and avoid twisting your body while setting the object down. And only release the object when it's located where you want it. To avoid injury, don't release your grip until the object is secured. When lifting or moving some items, it is smarter to use equipment made for such tasks. Forklifts, carts, dollies, hand trucks, wheelbarrows, hoists, chains, and ropes are some of the items which can make lifting and moving items easier. Employees must make sure they are properly trained to use the equipment and are wearing the appropriate PPE. When using moving equipment, there are some basic guidelines to remember as applicable. Secure the load with something appropriate, such as lashing straps, tie downs, or wrap. Use both hands to control the device. It is safer and easier to push than to pull. Avoid stairs, inclines, and other uneven surfaces when possible. Using a forklift requires the operator to have specific training and certification. Never operate a forklift unless qualified. Here are some additional guidelines to keep the back strong and healthy. Never lift objects over your head and never reach overhead to grab something. Use a step stool or platform to move closer to the area to place the object or to reach for an object. Be careful as you move onto and off the stool or platform. Never reach over something to lift an object. Move the item or step around it to get to the object you are lifting. Never jump down from the short heights such as truck beds or loading docks. Even though the distance is small, the shock from the impact can injure the discs and other parts of the back. Split larger loads into smaller loads whenever possible. When performing a physical labor involving the back, such as raking, shoveling, digging, make sure you use proper techniques to keep the back safe. The same steps to correct lifting apply. Preventing back injuries requires not only proper lifting and carrying, but a good posture, exercise, and proper diet. The back deteriorates with age, and it's important to do everything possible to keep the back healthy. Good posture is important for a healthy back. When sitting or standing for long periods of time, posture can affect the back either positively or negatively. It's important to learn the correct way to sit, stand, and how to support the back. Stand or sit up straight, don't slouch. Place a pillow behind the lower back for additional support. Keep knees at 90 degrees and feet flat on the floor. Exercise while sitting by tightening the stomach and buttocks muscles and holding for 5 to 10 seconds. Occasionally get up and walk around if sitting for prolonged periods. When standing for prolonged times, stand on floor mats and raise one foot on a stool or step, and wear appropriate shoes. Exercising on a daily basis can strengthen the back, stomach, and leg muscles, increase flexibility, and increase the chance of maintaining a healthy back for many years. Make exercise a priority in your life. Just 15 minutes of exercise a day can help prevent injuries and back pain. Walking, running, biking, or swimming are just a few possible types of exercise that you can do. There are simple exercises you can perform which help maintain a healthy back. When possible, try to incorporate some of the following into your workday routine as well as at home. Shoulder shrugs. Stand or sit with your arms at your sides. Shrug shoulders up towards the ears and hold for 10 seconds, then relax. The hip flexor stretch. Lay on the back with one leg straight and the other bent at the knee. Slowly bring the bent knee up to the chest and press the back firmly on the floor. Hold for 5 seconds. Bring the knee back down and switch legs. Repeat 6 times. Partial squat. Stand up straight, bend at the knees, and squat down about halfway to the floor. Hold this position for about 10 seconds. Stand up and then repeat 6 times. Use a chair for balance if necessary. Partial sit up. Lie on your back with your knees bent and feet on the floor. Place your arms across your chest and slowly raise your head and shoulders off the floor. Hold for 10 seconds and then lower the head and shoulders to the floor. Repeat this step 6 times. It's also important to maintain a proper diet. What you eat can affect the health of your back. Being overweight adds extra stress and strain to the back and body. Maintain the proper weight for your height, eat appropriate portions, avoid unhealthy foods, snacks, and drinks, and consult with a medical professional concerning the types and amounts of food which are right for you. In conclusion, maintaining a healthy back is an important part of your overall well-being. From the moment you know you're going to have to lift and or carry an object, you should start thinking about how to protect your back from an unnecessary injury. Do it correctly and your back will be your friend for a lifetime. Don't become a statistic and wind up on your back. That concludes our safety training. If you have any questions about back safety, please see Andrea. Thank you.